A complete purge at the United States' most influential vaccine advisory panel, unthinkable until now, has left health experts reeling. That's how one stunned observer summarized the recent turmoil at the Centers for Disease Control and Prevention, where the entire advisory committee on immunization practices was abruptly dismissed. Right when federal public health strategies were already under the microscope, this sudden overhaul has plunged everyone into confusion and concern. What on earth is happening behind the scenes? And why does it matter for all of us who rely on these experts for life-saving vaccine guidance? Today we'll unravel the twists and turns of this extraordinary situation. Why the new Secretary of Health and Human Services, Robert F. Kennedy Jr., dismissed more than a dozen panel members in the blink of an eye, the ripple effects for pregnant women trying to protect themselves and their babies, and the fears that the committee's new leadership might not actually believe in the very science they're supposed to safeguard. We're about to dive deep into a storyline filled with political maneuvering, uncertainty about the future of vaccine coverage, and a real clash between data-driven evidence and rising mistrust of public health protocols. Why should you care? Because the decisions made by this group, or what's left of it, directly impact every corner of the country. Who gets a vaccine, when they get it, and whether it'll be covered by insurance or federal funding. That's your wallet, your family's safety, and the well-being of entire communities on the line. In this comprehensive overview, you'll hear about the actual reasons behind firing committee members who were once considered the gatekeepers of immunization policy. You'll also learn how uneasy some pregnant women have become about access to crucial COVID vaccinations. And we'll address the bigger question: who can the public trust when the central authority that once set the gold standard for vaccine guidelines is suddenly rife with political upgrades and scientific downgrades? In this exploration, we'll talk about the shocking new membership of 8 appointees, some of whom have voiced deep suspicion toward the very immunizations they're now supposed to evaluate. We'll examine the severe consequences for families if recommended vaccines, like those for COVID, influenza, or respiratory syncytial virus, stop being covered by government programs. Plus, we'll investigate the hidden financial burden that might fall upon parents, especially if routine immunizations for young children or pregnant women become pay out of pocket or do without. By the end of this story, you'll understand how an advisory body that once prided itself on careful research and months of deliberation got flipped upside down in a matter of days, and why so many scientists and clinicians are shouting that the current process is completely unreliable. One might wonder, isn't the Advisory Committee on Immunization Practices just another forgettable group of bureaucrats? Quite the opposite. This panel has existed for more than 60 years, tasked with analyzing the safety and efficacy of vaccines before the CDC director signs off on final recommendations. In normal times, the process is as thorough as you'd expect from federal agencies entrusted with public well-being. A separate FDA panel first reviews whether a vaccine passes muster based on clinical trials and safety data. Then, if the vaccine is deemed safe and effective, it's transferred over to the CDC for the ACIP to pore over the details and vote on potential widespread use. Only after a formal vote do government officials endorse the vaccine in question, and from there, insurance payers often decide if they'll fully cover it, partially cover it, or reject it as an out-of-pocket cost. This multi-layered review was intended to minimize errors and hold vaccine manufacturers accountable. But in an age where definitive science is questioned daily, that thorough process has become a political battleground in which facts and fears are colliding. Enter the new Secretary of Health and Human Services, Robert F. Kennedy Jr., a figure who has made no secret of his criticism of certain vaccine practices and has expressed doubts about the necessity and safety of specific shots. It only took 58 seconds for him to announce the sweeping dismissals on social media, a move that tore through the scientific community like a thunderbolt. All at once, a once stable committee was replaced by a leaner, more ideologically divided group of appointees. Among the new members are individuals linked to organizations that question the basic premise of widely recommended immunizations. For many in medicine, that's akin to hiring referees for a major sports league who openly resent the sport itself. Historically, the ACIP was entrusted to those with decades of experience in immunology, virology, pediatrics, and epidemiology. Now, there's fear that some members may prioritize personal ideology over years of aggregated scientific evidence. But let's not oversimplify. The new lineup isn't just a collection of people bent on upending vaccine confidence. Many are respected in their own right, but hold contrarian viewpoints. Nevertheless, their perspectives on issues such as COVID immunity and the alleged risks of certain vaccine components, like thimerosal, a well-studied preservative, stand in stark contrast to the previous committee's conclusions. So, the real question is, can this new ACIP separate personal mistrust from empirical data, or will their doubts overshadow the guidelines they're meant to shape? One colossal concern surfaced almost immediately. Pregnant women who want to be vaccinated against COVID face potential hurdles if coverage is withdrawn. When the Secretary proclaimed that the Department of Health and Human Services would no longer cover certain coronavirus immunizations, including those for pregnant individuals, the move caught many by surprise. Hospitals, clinics, and pharmacists found themselves in a legally precarious position. If the official stance from the top says, "We don't recommend it," does that mean a pharmacist who administers the injection is going off the record? Some have decided it's safer not to offer it at all, pushing anxious mothers-to-be into a corner. The potential cost to pay out of pocket can climb to around $150 or more. While that sum might be feasible for some households, it's a budget-breaking amount for others. This is not just about paying a fee, it's about losing access to a protective measure they desperately want. From a public health perspective, experts like Michael Osterholm, who leads the Vaccine Integrity Project at the University of Minnesota, are sounding the alarm. According to Osterholm, pregnant women run significantly higher risks of severe outcomes if infected with COVID during pregnancy. Not only could they face complications themselves, but the health of their unborn children is also at stake. Vaccinations were long considered a straightforward way to mitigate this risk, substantially reducing the chance of serious illness and hospitalization. Now, though, these women are effectively in limbo. They either have to hunt down a rare healthcare provider willing to administer the vaccine without coverage, or attempt to pay for it on their own, if indeed the vaccine can even be found in some areas where official recommendations are overshadowed by the Secretary's new approach. All of this is deeply intertwined with how the ACIP used to function, setting not just medical guidelines, but also financial frameworks that both public and private insurers tended to respect. A recommendation from the panel often acted as the green light for coverage. So, losing that endorsement doesn't just trigger confusion among clinicians, it shifts the entire infrastructure of how vaccines are paid for. Predictably, lower-income households, single parents, and communities of color could be the first to suffer, lacking both the extra cash and the free time to chase down alternative immunization routes. The end result could be an uptick in outbreaks, as those once protected pockets of society now become hotspots for preventable illnesses. Another pressing controversy emerged in the lead-up to the newly restructured committee's first official meeting. In a typically normal scenario, the ACIP would produce meticulous documentation about every vaccine under review weeks in advance. Seasoned CDC staffers would scrutinize the data in collaboration with recognized subject matter experts, ensuring that all possible information, from clinical trial outcomes to real-world vaccine performance, was on the table. Then the meeting would happen, enabling members of the public, scientists, and the media to witness the deliberations. But this time, no months-long vetting procedures, no painstaking breakdown of scientific findings. The standard operating procedures switched from a slow boil, perfecting every detail, to a hurried scramble. As if that weren't startling enough, one newly appointed speaker, who had a history of affiliation with the Children's Health Defense Fund, a group widely labeled as anti-vaccine, ran into an evidence credibility crisis. In the presentation slides, there were references so slipshod that they turned out to be entirely fabricated or irrelevant. Suspicions arose that artificial intelligence had been used to generate these sources. For a committee priding itself on rigorous academic discipline, ghost references that didn't actually exist or contradicted the speaker's own claims were a serious blow to integrity. Nobody was sure if the official meeting would even proceed as scheduled, or if it would compromise the entire credibility of the group even before they took any significant vote. This meltdown in trust has led prominent figures, including Michael Osterholm, to advise that any current official guidance from the CDC on vaccines, whether it's for SARS-CoV-2, influenza, or respiratory syncytial virus, be viewed with deep skepticism. That's a weighty statement from a longtime advocate of vaccination. He doesn't want people to dismiss the decades of scientific progress behind immunizations, but suggests that the current official stance may be colored by ideological agendas. So, if the public can't trust the new ACIP, where do they turn? Osterholm's solution is forging a separate path. Under the Vaccine Integrity Project, he and a host of experts from professional medical bodies like the Infectious Diseases Society of America or the American Academy of Pediatrics aim to compile their own set of recommendations, essentially filling the void left by the ACIP's political transformation. Their plan? Meet, gather peer-reviewed information on each vaccine's safety and benefits, then disseminate updated guidelines through the networks of practicing doctors, pharmacists, and educational institutions. It might replicate the same meticulous approach ACIP once had, hoping to maintain the same standard of quality, but it will lack the official federal stamp. The question is, without that official endorsement, will institutions follow their advice, and will insurers uphold coverage decisions? Before you wonder if this entire ordeal is just an isolated federal shakeup that doesn't affect your day-to-day life, consider how vaccine guidance shapes rules at schools, workplaces, travel companies, and even your local pharmacy's immunization schedule. If coverage for vital vaccines is yanked away, or if the guidelines become so muddled that providers decide it's simpler to not carry them at all, it may lead to a public health crisis. It goes beyond the question of one or two recommended vaccines. Historically, mass immunization campaigns have been the backbone of reducing diseases like measles and polio. A fracture in the system now could open the door to resurging infections we once controlled or nearly eradicated. You might be thinking, well, how bad can it get? Experts warn it could get significantly worse in a short span. The last 3 years already tested America's resilience against pandemics. Now, with a polarized environment around something as foundational as immunization, we could see coverage rates drop precipitously, leaving vulnerable groups like pregnant individuals, children under 5, and immunocompromised adults at higher risk. Will hospitals again be overcome by waves of preventable illnesses? Will the trust vacuum lead to pockets of disease outbreaks, erupting unpredictably in major cities? The answers are looking grim unless clarity and strong leadership re-emerge. If you're appalled or riveted by how drastically politics are reshaping what used to be a stable scientific process, take a moment to let that fact sink in. Then, if you're finding this breakdown eye-opening, consider showing a little support right now, maybe by giving this piece an approving nod or a virtual thumbs up. Every token of engagement helps more people discover these critical details, which should never stay hidden from public view. One of the biggest personal stories coming out of this saga is that of expectant mothers feeling thoroughly abandoned. In normal circumstances, pregnant women trust the combined assurance of obstetricians and official health agencies. But imagine that your doctor recommends a COVID vaccine for your own safety, while the secretary effectively strips away coverage and possibly even the availability of that vaccine in many medical settings. Families that have never had to scramble for routine immunizations are suddenly finding that they must weigh whether it's worth the out-of-pocket cost. Others suspect that unvaccinated pregnant women might be at elevated risk for intense complications, including hospital stays in already overstretched facilities, plus the emotional strain of worrying about the health of the unborn child. For many, losing the safety net of science-based guidance is more than an inconvenience. It's an actual threat to their well-being. It's also worth noting that the ACIP historically functioned with a depth of data that was the envy of many global health organizations. Its recommendations rippled outward to guide entire states, which then formed their own immunization programs based on federal guidelines. School districts relied on ACIP for updated suggestions on whether to include new shots, like those against HPV or meningococcal disease, in their mandatory schedules for enrollment. Pediatric clinics, family practitioners, and hospital networks set their own stocking orders based on ACIP's decisions. Now that many states see this once trusted body in disarray, confusion might lead to a fragmented approach, where your zip code could determine how protected you are against certain illnesses. That's a sobering prospect for any parent trying to safeguard their children. What's even more disturbing is how fast misinformation can spread when official endorsements are uncertain. Social media abounds with half-truths, cherry-picked statistics, and sensational claims that discourage people from seeking vaccinations. Conspiracy theories linking routine immunizations to a myriad of unfounded side effects were once at the periphery but now stand a chance to infiltrate the mainstream. By shaking the structural integrity of the ACIP, the government inadvertently fuels those who say, "Look, even the official panel doesn't support these vaccines anymore," even if the reality is that the newly picked members recently dismantled the entire established framework. With all that said, perhaps you're thinking, what's the next chapter? How do we reclaim a sense of trust and competence in the nation's vaccine recommendations? For Michael Osterholm's team, it's an all-out push to rally the scientific community. They're negotiating alliances with professional associations, like the American Academy of Pediatrics, to create parallel guidelines. They hope doctors, pharmacists, and insurers will accept these parallel guidelines as if they were federal recommendations. But the success of that approach remains up in the air. Meanwhile, a large fraction of CDC staffers, who have spent years or even decades ensuring the agency's reputation for rigor, feel trapped in a bureaucratic quagmire, unable to override the new political path. Some insiders speculate that the ACIP might remain in flux as long as this administration is in charge of health policy, causing a long-term slump in public trust, precisely the opposite of what's needed to maintain robust vaccination rates across the United States. Could there be a silver lining? Some optimists believe that this crisis might spur new transparency measures. Perhaps it will encourage a deeper level of scrutiny on governmental committees, forcing them to release more thorough data to the public and allowing external analysts to cross-check official statements. In an era when faith in experts has been eroded, a radical push toward openness might help rebuild confidence. Others, however, fear that we are so mired in politics that any push for clarity will get lost in the daily churn of conflicting information. Meanwhile, the swirl of uncertainty has real-world repercussions. Medical clinics are receiving frantic calls from patients unsure if their next scheduled immunization is still advisable or even legal under the new guidelines. Health insurance representatives wonder whether they are supposed to reimburse families for vaccines that the Secretary himself publicly disavows. Rural clinics, which previously participated in federal vaccine distribution programs, might find themselves without the supply or the liability protection they depended on. And for urban centers with large vulnerable populations, any drop in immunization rates can have an outsized effect, leading to local public health threats that quickly become regional emergencies. We're at a tipping point. Either new leadership emerges strongly enough to reestablish a science-based standard for immunization decisions, without the near-constant overshadow of politics, or the entire system cracks further, leaving individuals to navigate a patchwork of conflicting advice. The old ACIP had decades of storied history, employing slow, methodical methods for a reason. They might have been overly cautious at times, but they rarely made a hasty judgment. Now that caution is replaced by abrupt changes and last-minute realignments. If you're on the edge of your seat, you're not alone. And guess what? If you care about continuing our conversation and ensuring more people learn about these revelations, feel free to subscribe or follow along for future updates. That small action can help us break through the noise, providing a stable source of information in these turbulent times. As for Michael Osterholm, he exudes a steadfast resolve, stating that his mission with the Vaccine Integrity Project is non-negotiable. He insists the group will keep producing credible, thoroughly researched guidelines as long as the official ACIP remains compromised by politics. The goal isn't to undermine public officials, but to fill the void left by a seemingly untrustworthy leadership. In the eyes of Osterholm and many of his colleagues, the science still speaks loudly. Vaccines reshape the modern world by beating back diseases that once plagued humankind. That legacy, he believes, is too important to leave at the mercy of confusion. Ultimately, the question becomes, will tens of millions of Americans who once took their cue from the CDC look elsewhere for guidance? For now, the path remains unclear. The new committee seems set on forging ahead, possibly rewriting core recommendations on influenza shots, RSV immunizations, and even the routine continuum of childhood vaccinations. Will they uphold the evidence-based approach that has saved countless lives? Or will they steer the country down a path of withheld coverage, restricted availability, and mounting vaccine hesitancy? We simply don't know. But as new details emerge from inside sources about contradictory references, unanticipated cost barriers, and a wave of hesitation among pregnant women, we do know that healing the nation's trust in its own medical authorities won't be simple or immediate. Perhaps the only certainty is that the entire drama points to a new era of public health governance, one in which no institution can assume unconditional confidence. Citizens, more than ever, must stay alert, question changing guidelines, and demand transparency from those in power. The story is still unfolding, and each day brings another twist, another policy reversed, another statement contradicted, another demographic left wondering if they'll be forgotten by an advisory board that once promised to serve everyone equally. By analyzing every aspect of this fallout, from cost burdens for families to the chilling effect on pregnant women, we catch a glimpse of how deeply immunization policy touches our lives. For decades, Americans often took for granted that the CDC's guidelines were grounded in solid, peer-reviewed evidence. Now, as the dust settles from this major upheaval, it's anyone's guess whether that faith can be restored anytime soon.